It is 2 a.m. You're waking up with that familiar terrifying cramping in your stomach. You're running to the toilet, and as you sit there, you realize it is happening again. You're having a flare up. If you have Crohn's ulcerative colitis, it's nothing more anxiety inducing than feeling your stomach come back after a period of remission. It can feel like a massive personal failure. You might be sitting there thinking, what did I eat? What did I do wrong to cause this? I want you to stop there. It's not your fault. Flare ups are natural, frustrating part of living with inflammatory bowel disease. You might feel entirely out of control right now, but I promise you, you are not. Today, I'm going to walk you through exactly what you need to do to get this flare up under control. We are going to cover the emergency red flags that mean you need a hospital right now, the specific medication adjustment you might be able to make at home to stop the inflammation in its tracks, and the daily habits you need to adopt to calm your gut down. Hello everyone, I'm Dr. Kapil Dhingra, and you're watching my channel. Take a deep breath and let's get into it. First, we need to establish if you're actually having a flare up or if you're just experiencing a bad tummy day. A flare up is when your condition becomes active again and you feel noticeably unwell. We define this clinically by looking at specific measurable changes in your bowel habits. Signs of a flare up include going for a poo more than 5 times in 24 hours or more than what is normal for you. You might also experience loose poo or diarrhea with blood or mucus for more than 3 days alongside severe abdominal pain. You might suddenly find yourself urgently needing to poo with very little warning. Everyone experiences flare up differently, and they can last anywhere from few days to several months. But it is absolutely crucial to remember that your gut is intimately connected to the rest of your body. When your immune system ramps up to cause inflammation in your bowel lining, that inflammation often spills over to your bloodstream as well. Because of this, you might experience symptoms completely outside of your digestion. This includes severe joint pain and swelling, what we call arthritis. You might notice swelling and redness in your eyes, painful mouth ulcers, or strange skin rushing popping up. And of course, there's crushing, overwhelming fatigue and the toll it takes on your mental health. A flare-up is a whole body event, which means it demands a whole body response. Before we talk about what you can do at home, we need to cover the medical red flags. You'll always know your body and your condition better than anyone else. If you feel you need urgent care, do not hesitate to phone 111. And if you need emergency care, call 999. Do not try to tough it out at home or wait for a routine clinic appointment if you experience any of the following severe symptoms. You must go to A&E or call 999 if you have severe dehydration or malnourishment, or if you are vomiting up blood. Another massive red flag is having severe tummy pain combined with high temperature and a rapid heartbeat. This can be a sign of severe, potentially life-threatening complication. You also need emergency care if you're bleeding non-stop from your bottom. For my patients who have already undergone surgery, and if you have a stoma and you think it might be blocked, this is an absolute emergency. Signs of a stoma blockage include not passing any wind or poo, or conversely passing more watery poo. You might experience nausea, vomiting, severe tummy cramps, and you might notice your tummy or the stoma itself becoming so solid and blocked. If you see these signs, do not wait. Seek emergency care immediately. If you do not have those red flags, let's look at your immediate action plan. If you have a written personalized care and support plan from your medical team, follow that guidance. If you do not have a plan, you need to contact your local IBD team or GP via phone or email right away. Now, I need to be extremely clear here. This next step applies only if you've got ulcerative colitis. This advice does not apply if you've got Crohn's disease. If you have ulcerative colitis and experiencing a flare-up, you might be able to temporarily increase the amount of your 5-ASA medication. 5-ASAs are anti-inflammatory drugs that work directly on the lining of your bowel. So if you decide to increase your dose, it is vitally important to inform your IBD team or GP of any changes as soon as possible by telephone or email. You may also want to check with your healthcare professional first if you're pregnant or have another health condition. But generally, you can take up to maximum dose for 8 weeks unless you have already been told by your healthcare professional not to increase your dose. For example, if you take Celofoc, the maximum is 3 grams per day. For Esacol, Mezavant and Octeza, the maximum dose is 4.8 grams per day. For Pentasa, it is 4 grams per day. You can check the patient information leaflet inside your medicine box to find out exactly what dosage is in your specific medication. If you have been prescribed suppositories and you have a supply of these at home, you can start taking these too. You can take these every night as well as increasing your 5-ASA tablets. Delivering the medication directly to the inflamed tissue from the bottom is often one of the fastest way to get relief. Here's the crucial part that many patients miss. Even if your symptoms settle quickly, you must continue taking your increased dose for full 8 weeks. Then you reduce back down to your regular dose unless advised otherwise by your IBD team or GP. This ensures the underlying inflammation is truly healed. If your symptoms do not improve despite these changes, contact your team. Whether you have Crohn's or colitis, there are immediate non-medical steps you must take at home to protect your body and reduce the severity of the flare. We do not entirely know what causes flare-ups, but disruption in medication, ongoing stress, and gut infection can all be triggers. First, stay hydrated. When you are flaring and experiencing severe diarrhea, you are losing fluid rapidly. It is important to make sure you're drinking enough to replace what you have lost, and in doing so, getting the right balance of sugar and essential salts in your body to keep yourself hydrated. Second, eat well. Living with Crohn's or colitis may mean making some changes to your diet, especially during a flare. You may need to avoid certain foods to help your symptoms or take extra care to make sure you're getting the right nutrients. There's no single gut diet that works for everyone, so it is about understanding how food affects your unique condition. Keep a diary of your symptoms can help you see if you become aware of any specific triggers for you. Third, take rest and sleep. Your body is fighting a massive internal battle against inflammation. You need to manage your fatigue by prioritizing rest and giving your body the energy it needs to heal. Fourth, protect your emotional and mental well-being. There's a deep physical connection between the brain and the gut. Stress and anxiety can physically worsen your bowel symptoms. So reach out for support, read up on mental health and well-being, and do not try to carry this burden entirely on your own. Finally, I need to give you a critical warning about painkillers. When you are in pain from stomach cramps or joint aches, your first instinct might be to reach out for over-the-counter painkiller. You must absolutely avoid NSAIDs, which stands for non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen. Taking these can actually trigger a flare-up, make your current symptoms significantly worse. Stick to paracetamol for pain relief, and if that is not enough, speak to your GP. Dealing up with a flare-up is exhausting. It is scary, but remember that you have options. You have an IBD team ready to help, and you have the knowledge to take the right action right now. Continue taking your regular medications as normal unless your doctor has nurse advised you otherwise. If you found this video helpful and reassuring, please hit the like button and subscribe to my channel for more expert gastroenterology education. I'm Dr. Kapil Dhingra, and I'll see you in the next video. Thank you.